Hi everyone, welcome back to MD-VOD, where today we're talking about our eye health, and we're here with ophthalmologist Dr. Brian Boxer-Wachler. And thanks for sticking around because we're going to answer your questions on Facebook and Twitter. First question up, doctor, what is laser surgery or LASIK? Great question.
LASIK is the most commonly performed vision correction procedure in the United States. And what it does is it treats people's need when they're wearing glasses and contact lenses, reshaping the eye so that most times they don't have to have any need for these contact lenses and glasses anymore. So it gives them tremendous freedom. Now, LASIK itself, in a simplistic form, is 3 steps. The first step is we make a little flap in the outer cornea, which is like the lens of the eye. We lift the flap up. The second step is we use a laser that's programmed for each individual prescription. It reshapes the cornea, and then we put the flap back down. So those are the 3 steps. Recovery is typically 1 day, and most people can go back to their normal routine the very next day. And I've even had it myself. So I've been on the patient side of it from the LASIK point of view, and I can just tell you, it's incredibly life-changing.
Doesn't get better than that. Testimonial, an eye surgeon telling you he's had the eye surgery. Now, who did it? No, I'm kidding. Was it your partner? I don't know.
No, it was actually my fellowship director, Dr. Dan Dury, who's in Kansas City.
So your teacher, okay.
Yep, my mentor.
Yeah.
He's great.
So next up, Alan89, tell me about contact lenses and how can children start wearing them?
Contact lenses in kids can be a little tricky for parents, and I have 6-year-old girls, so I'm already getting used to this whole negotiation phase with kids. So parents are going to be having their kids come to them wanting to do contact lenses, and it's not to be taken lightly because contact lenses, they overall are safe, but there can be some real serious risks, such as corneal infections that can cause real problems with the vision permanently. So contacts rest on the surface of the cornea. The most common types are soft lenses. And when kids want to do this, I usually recommend considering it no earlier than when they're about 10 years old. And that's about the time when they can perhaps take on that responsibility because, if these lenses are abused or slept in, that does increase the risk of infection. So you also have to see how your kid is in terms of that responsibility, and sometimes the maturity level may not be there and you need to wait until they're older.
That's a great take home. Kids and contact lenses, great question. Next is Becca Smith. Why should I get, this is my question too, why should I get an annual exam and what's the biggest risk if you don't do it?
The reason why you want to have an annual exam is you want to be able to make sure that there's nothing silent that's brewing inside your eye that you may not even notice. Just because your eye feels good, there's no discomfort, vision's fine, doesn't mean that there's not something else happening. That annual eye exam is going to allow the eye doctor to be able to find if there is something that is of concern.
Okay, good question and great answer. Puppy Loves 77 wants to know, what should I ask my doctor? Meaning, what should they ask your doctor, I guess, about seeing an ophthalmologist? It's a good question. I don't know.
Can you repeat that?
Yeah, I think she's asking if you see your doctor, when should you see an ophthalmologist? Like, what should you ask your primary care doctor about seeing an ophthalmologist?
Many times, the ophthalmologist will be the primary care doctor for the patient's eyes, and at times it may also be the optometrist. So if you're seeing either of those two, it doesn't hurt to always ask, is there a need for me to see someone else who's a specialist in a certain area? So the key is you want to have open communication with your doctor and never be afraid to ask any questions to your doctor.
That's great advice. What's the #1 risk for going blind? Great question.
Well, I think we have to take that in context. If it's somebody who's young and they're playing sports, having a sports-related eye injury could be a problem. One of the basketball players at Duke had a very fluky injury, not wearing any eye protection while playing basketball. Virtually no one does. And he had an optic nerve injury and lost a lot of vision in one eye. It was a fluky thing. If you're talking about people in the older baby boomer population, The number one risk for going blind, quote unquote going blind, is macular degeneration. So it depends on what you're doing in terms of what the risks are. But I think take-home message there for sports that involve any potential trauma to your eye, always a good idea to wear some eye protection.
Great advice. And next up, we have Baxter 22. What are cataracts and what are the most common factors that determine whether someone will get them?
Cataracts are pretty common. They involve a clouding of the internal or biological lens of the eye. And that in turn then starts to cause glares at nighttime, halos, reduced vision, fuzziness, fogginess. And the risk factors are being outside for years, not wearing sunglasses, and just age. So, but the big things you can do is to be really good about wearing sunglasses outdoors, protecting your eyes from the sun, because that is a known risk factor.
So again, wear eye protection, the common theme today. Lucky Lincoln wants to know, can medications I'm taking give me symptoms that I should be aware of?
That's a big answer, and I would say the short answer is yes, and the long answer is if you're taking medications, read the fine print. Each medication prescriptions come with almost like a little mini book, and you want to read that because you may see that there could be some side effects that relate to your vision, and if you have those, then you should talk to your doctor about that.
That was great advice. I want to thank Dr. Brian Boxer-Wachler, ophthalmologist extraordinaire. That was great stuff for kids even. Make sure if you missed any of today's show to see us on MD-VOD, emPOWERme.tv. I'm Dr. John Kennedy, and please join us next time here on an MD-VOD.